Now, around 1 in 6 people in Ireland will experience a mental health problem like anxiety each year, which has steadily increased over the last 20 years. It is also likely that individuals do not seek help for significant levels of anxiety, meaning many remain without diagnosis or treatment. I'm delighted to be joined on the line now by Dr. Cait Verling, a clinical and counselling psychologist in the Dungarvan Community Hospital. Cait, you're very welcome to CRY.
Thank you very much.
Delighted to have you. And look, this is a subject, I suppose, that there isn't a family in the country that hasn't been affected in some way by mental health and in particular anxiety.
Yes, that's very true. And unfortunately, anxiety rates do seem to be increasing, and that probably the prevalence of them is going up, and also that we're more aware of the difficulty now for people.
Yes, indeed. And I suppose the unfortunate thing with anxiety or indeed mental health, it's very much an invisible illness that, unless you're suffering from it yourself, you won't be able to see it in anybody else.
No, and I think it's a pity that, I suppose, mental health issues are still considered kind of a taboo subject. If somebody had a physical problem, they'd have no problem, I suppose, speaking to people about it and seeking support. But it's still very difficult for people to admit that they have these difficulties with anxiety or other mental health problems. And therefore, they end up often without support and not realising there are so many other people who share the difficulties as well.
Yes, indeed. I was watching the Claire Byrne programme last night, and there was a lady on whose daughter, Nicole, of age 21, took her own life just over a week or so ago. Now, in her case, she was being bullied and suffered from a lot of bullying. But I suppose that all feeds in to anxiety in and of itself.
It does, and I suppose the causes of anxiety are both nature and nurture, if you want to put it that way. So there's often, for children who have anxiety, there's often a family history of it or other people within the close family that might have struggled with anxiety. So there is a genetic element to it. And also the situational factors that you're talking about, environmental factors like bullying and other pressure, other difficulties going on within the child's family, within the child's life, can contribute to it as well.
And in the course of your work, are you finding now that you're dealing with a lot more younger people, like children, maybe now than you would have been in the past?
Yes, I suppose we would work with a lot of children with anxiety, and anxiety is actually the main cause, the number one cause of referral to primary care psychology services now. And it's becoming more and more common now. People's awareness of it is increasing as well. But yes, young children struggling with anxiety, we're meeting it every day of the week now, unfortunately.
Now, I'm not lucky enough to be a parent myself, but I can imagine the fear and the worry and the concern of parents in how they actually deal with their children, how they can help them, how they can support them. And that's why there's an event coming up in Lismore next month. You're going to be dealing with all of that.
Yes, we are. We've actually run a series of public talks for parents over the past year in Waterford City and West Waterford called Helping Your Child with Anxiety. And because we were meeting so many parents whose children were struggling with it, and parents were struggling as to how to help their children, and it causes a huge amount of stress in the family. So we've been running these talks, which are about an hour and a half in length, explaining to parents the nature of anxiety, how it affects children, what contributes to it, and also, most importantly, giving parents practical tips and strategies to help their children who are struggling with anxiety that they can actually use at home.
Yes, which I think is absolutely fantastic. And as somebody myself, who I've been in the unique position that I have suffered from anxiety, it is a difficult thing for somebody to open up and talk about, but also it's a difficult thing to identify and trying to figure out, well, what is the cause of the anxiety in the first place?
It can be really difficult to talk about, but I suppose it's really important to acknowledge, and it's one of the first things that we say in our talk, is that anxiety is actually a normal emotion and it can actually be quite functional. A little bit of anxiety can help us perform in our career in all kinds of ways, but it's when it kind of tips over and starts to affect our functioning and starts to come out in more normal situations where it shouldn't be there. That's really when it starts to create problems. So it's first of all normalising anxiety for your child and explain to them that it's a normal emotion and that we can have tips and strategies that can help us. And a lot of that for parents is managing their own anxiety, showing their children, look, it can be managed. Mom is very stressed today. I'm trying to get all this done. You know what, Mom is going to sit down for a couple of minutes, going to take a few deep breaths, and just because I suppose it's very important. If parents are calmer, children will be calmer. So there's a lot that parents can do managing their own mental health also that can help their children.
Now, are there any telltale signs, for parents that are listening right now, and if they find that their child, isn't the most talkative or the most approachable, are there any telltale signs that a parent should be aware of, that they might figure out, or they might have some idea that there's something not exactly right here?
There can, and very much depends on the developmental stage of the child. So anxiety can come out and be seen in different ways depending on the age of the child. So for smaller little children, say preschool children and small children, they may be, for example, reluctant to separate from their mom and dad. Now, a little bit of that is normal, but maybe if they feel it's a bit too much, they're getting very distressed if they're separating from their parents, crying a lot and finding new situations difficult. And then with older children, it can come across sometimes in physical ways as well. For example, having a lot of headaches, complaining a lot of headaches, tummy aches, going to school. And sometimes it can come out in anger as well. Children can become very angry and distressed. And sometimes that can mask it where there's actually anxiety underneath it. So maybe some of those issues can come out and parents might not be aware that it's anxiety. And then for teenagers, a lot of it can be kind of peer-related anxiety, a lot of worry about their appearance, how they look, a lot of performance-related anxiety in relation to school or sports. And sometimes children can be socially quite anxious as well, maybe in new situations, meeting people that they don't know or in large crowded areas. So it really depends on the individual child and their age as well.
Yeah, I was talking last week with a lady called Sharon D from Athlone about a project that she has launched called Ireland's Got Curves, which was about trying to empower young people to feel positive about themselves and about their bodies. Because as you say, there's a lot of peer pressure out there about how you look and your appearance and all of that. And all these kind of things have to do some good in trying to improve a young person's outlook.
Definitely, and I remember back in the 90s there was interesting research that came out that showed that women, after looking at kind of magazines, popular magazines with models in them, that women's mood actually decreased after looking at them. And now it's actually worse in the sense that because of Instagram and all of these different apps, teenagers are bombarded. It's not just looking at a magazine, it's day and night being kind of bombarded with completely unrealistic images that they feel they have to aspire to. So definitely social media, I suppose we're seeing as psychologists, is definitely adding extra stress and anxiety, and there's a lot of research now that has come out even from Australia as well, finding that it can increase not only children but parents' anxiety as well. Being on screens and spending a lot of time on social media, it can really increase people's anxiety, and teenagers definitely.
Now, this presentation that's taking place in Lismore, it's on Tuesday the 27th of February at 6:45pm sharp. It's on in the Bullskull Boher na Nave, a school I know well in Lismore. How do people go along to it? What do they have to do?
They have to register in advance for it, because I suppose it's depending on the numbers that we have, the room that we have. There's only a certain amount of places available. So they have to register, and they can text their name and address along with the word Lismore to 086 145 3629. Or alternatively as well, they can email Lismore and their name, address and number to this email address, which is stresscontrol, all in small letters, .se@hse.ie. And then they'll get a text or email back to state that they have a place. Now, it is completely free of charge, but sometimes if it's oversubscribed, it just means they'll have to wait for the next one, but we do run them regularly.
Absolutely fantastic. And of course, if people can't attend, I presume that the usual helplines like Childline, the Samaritans, Pieta House are always a good tool if you need to use that service.
Absolutely, and we have a very good service in Waterford City as well, and people come from West Waterford there. We have a drop-in service, psychology drop-in service for parents, which is every Wednesday morning from 9:30 to 12:30 in the HSE in the Cork Road in Waterford, where parents can come with no appointment and discuss any concern they have about a child. So they can also come there if they feel maybe that they haven't gotten everything they need from the talk, or they'd like a little bit of extra, because I suppose the talk is more of a presentation, and we can't obviously be dealing with individual cases at that talk. So if they have concerns or worries about their child, they can come there as well.
And of course, it's going to help to banish the entire myth, and get, as they say, get it out of the bag once and for all, because mental health is still a sort of a taboo subject, and there's nothing to be ashamed of in admitting that you're anxious.
Not at all, and I think it's really helpful for parents when they come to a talk like this and see, there's actually 50 other people in this room, who have concerns about their child's anxiety, and they can see that. Now, I mean, it's a lecture presentation, so there's certainly no expectation that they'll be talking about their own issues or anything. It's literally listening and some questions at the end, but even to go into the room and see there are so many other people there who have the same concerns can be really helpful, and they feel they're not the only ones.
Absolutely fantastic. Well, Cait, I really hope that people will take up this invitation to attend. Just to recap again, it's on Tuesday the 27th of February at 6:45pm sharp. Please arrive at 6:30 to sign in. It's on in the Bullskull, Bohern na Nave in Lismore. Now, to get there, you need to register. And how do you register? Well, you text your name and address along with the word Lismore to 086 145 3629. Alternatively, you can email Lismore, your name, address and a contact number to stresscontrol, all lowercase, .se at hse.ie, and somebody will be in contact by email or text to confirm that your place has been booked to this presentation. Cait, I wish you the very best of success, and I just want to say on behalf of everybody, thank you for the service that you're providing, not just to our young people, but to all people in trying to deal with mental health issues.
You're welcome.
And thank you for joining us on Drive Time. And I'm sure we'll talk to you again after this. And if there's anything more we can help with, we'll only be too delighted.
Thank you very much, Darragh.
Take care. Bye-bye.